Planned Parenthood isn't shying away from the fight for abortion rights in Alabama, even after the state passed a near-total ban on the procedure. The organization is building a large women's health clinic in downtown Birmingham. Construction could be completed around November, which is when Alabama's abortion law would take effect, unless blocked by the courts. So CBS News reporter Kate Smith is joining me now from St. Louis. You're working on another story in St. Louis, but this is about a situation in Alabama. You spoke to Staci, Planned Parenthood Southeast CEO. What did she tell you about the challenges that come with building this new facility in Alabama?
So when we were speaking to Staci Fox yesterday, she had a couple different things that were kind of challenges to building a new abortion facility, particularly in Alabama. The first is the regulatory landscape that they're dealing with in a place like Alabama, where state lawmakers have already been very hostile towards abortion access. So you're talking about things like hallway lengths, doorway frames, all of those kinds of restrictions to make it something of like a surgical ambulatory care center, something that you don't see other clinics who perform similar procedures having to do. The second is also just the political climate. So when I was talking to Staci yesterday, she mentioned that the contractors who work on the facility regularly are getting harassed by protesters. They're looking to dox them. They're finding their emails, their home addresses. They're doing all of these things to make life as difficult as possible while they're putting that construction on the facility.
On FaceTime, I want to play a little bit of what she told you about the effects of Alabama's new abortion law.
When we talk about access to health care, let's be honest, people of privilege, Kate, will always have access to the health care they need, including safe and legal abortion. What we're talking about is a war on poor people, a war on people of color. Those are people who do not necessarily have access to the health care that they can't take. They don't have the financial means. They can't travel the hundreds of miles it requires when we're shutting down access to care. That is not what healthcare should look like in this country, and that's not what Alabamians deserve.
So then what is Planned Parenthood doing to try and counter this law?
They're doing a couple different things. So they're going full steam ahead as if this law is going to be blocked. When I was talking to Staci yesterday, she has no thought in her head that this law will actually ever been able to be enacted. And that's because it goes blatantly against Roe v. Wade, Planned Parenthood v. Casey, all of these Supreme Court decisions that protect a woman's access to abortion care in her state, I should add, not just generally, but in the state that she lives in. So they're expecting that this law is going to be enjoined, they will not be impacted, and they're going full steam ahead on it. But I think it's also really important to note that, of course, Planned Parenthood does so much more than abortion care, right? They do cervical cancer screenings, they do STI screenings. For a lot of women, this is just their, primary care provider. So they're going full steam ahead. They told me their motto is "Our doors are always open." So they're planning on, no matter what, they're going to open in November.
So Fox said that Alabama legislators went against what the people wanted in banning nearly all abortions in the state. I'm sure there's going to be a counter argument to that because the people of the state of Alabama elected these leaders to make these decisions and choices. But what did she have to say about that?
So she said there's two things going on here. The first is just gerrymandering. She says that the way the state's all cut up, and not only in Alabama, but all over the South, what happens in the state floor, the state capitol floor, isn't necessarily representative of what the most vulnerable populations, low-income women, women of color, what happens in the state capitol doesn't necessarily reflect the best interests of those people. And then the second thing she mentioned was just some polling numbers. So she shared with me that 77% of Americans don't want to see Roe v. Wade overturned. That number is even higher when it comes to women. So she kind of just rejected the idea that, that women in the state really want to see Roe v. Wade overturned, really want to limit the idea of abortion access in the state. So she just flatly rejected that idea.
Okay, Kate, thank you very much.